I thought I would start by flipping this idea of an inequalities lens on its head and really try and be as resilient as possible and talk about equalities rather than inequalities, all right? If we're thinking in the spirit of a resilience move. And you'll notice as well that I've got quite a few people down here as co-authors of this piece of work, and it started to make me think more about the young people involved in HeadStart and other resilience building approaches, and when we name them, when we don't, whether they want to be named. Nat was talking this morning from the Big Lottery's point of view about the young people who were involved in thinking about HeadStart from the start, and they were talking about AntiStigma. And I just thought, again, that's maybe a conversation that we need to carry through now and beyond, when we're thinking about young people as co-producers of the work and young people as recipients of particular services or community interventions, and how they then might talk about it and own their identities. And in preparing for this, I had a conversation with a couple of people. One, Lisa Buttery, who's a young person with who's a member of our boingboing community, and she has had a long history of mental health service interventions herself. And then another young man who actually wanted to remain anonymous. He's very happy for me to use his story. And this story starts back, some years back, when I was a CAMS, a Child and Adolescent Mental Health Services provider. I was a therapist working in a clinic, and this was in the morning I had this a group of young people in the clinic, and one of them was this young man, Paul. So I'm in the clinic, in my room, with a particular foster child I don't need to name her, a social worker, actually someone from a school, and a foster carer, and this little girl. And there's a complete commotion outside. So we're trying to do some quite intense therapeutic work around some very painful issues that had happened in her past, and there's complete chaos outside my room. So I'm banging on the room, and one of the receptionists comes in and says, "Can you come and help us? Can you come and help us?" And I'm like, "Oh dear, right." And you can imagine it, because I've got this, it's a therapeutic environment, really tricky. And so I go out, and there's chaos in the waiting room, a young man in absolute terrible distress. And this young man, he wasn't himself, which is an interesting way of putting it. If I was talking in mental health form, I might have said he was psychotic or something like that. But, let's say he wasn't himself. He was very, very distressed, very upset. Everybody else was very upset. And everyone was saying, "Where's the psychiatrist?" And I was the only actual person from Child and Adolescent Mental Health Services in the clinic. So anyway, we managed to support that young man to have an immediate psychiatric intervention, which he absolutely needed. He was in such a terrible place. And he got better he actually needs some medication, really, really straightforward, intense psychiatric intervention. After that, he actually became much more settled. He was absolutely fine in his everyday life. But he was also living in a very tricky family context. Huge deprivation. He was a bright young man, and he had so many things stacked against him. And it was very interesting, because this young man then, actually, although he was one of our CAMS clients, we also, in our other identity that I had at the time, which was a university academic, got him teaching on some of our courses. So he was actually teaching professionals. And this this was one of the key days, actually, because in a minute I'll tell you about what happened in the afternoon that day, that really, really made me challenge the dominant therapeutic intervention models that are around and that many people work with and still do. And we were talking this morning about this task force money which is coming, which is fantastic. And I would just so implore you in this room to get involved with that, because on the one hand, I've been in conversations with people who are talking very much about clinical treatments and very much these nice guideline treatments, which we know for many of the young people that many of us are interested in support, they actually only go so far to support them. And other people here talking about social movements and mental health. So what a gulf between the treatment, the kind of traditional treatment model, and a social movement idea, into how you then integrate those different approaches, which is why I wanted to talk about Paul, because absolutely there was a place. Right then I wasn't saying, oh, let's have a social movement. I was saying, where's a psychiatrist? I need a psychiatrist, please someone help me find a psychiatrist. And then, so that happened in the morning. In the afternoon, I'd been invited to this mental health service users self-help group, young people. And they'd asked me to come along and talk about the resilience model that I developed with colleagues and community collaborators. And so I went to their group, and I got in the door, and immediately someone waved one of our books that we'd written at me and said, I hate this. And I'm like, all right, great. Nice to meet you, hello. And she said, oh, you're far too nice to professionals. You know, they've totally failed us. They felt some of the people in that room had been involved with mental health services for many years and hadn't felt supported by them. And were very, very critical of us as mental health professionals. And it was quite interesting though, because they'd invited me to this group to support them to think about resilience. And so I did the kind of training session that they'd asked me to do. And at the end, I'm sort of all smiley, and this young man I was chatting to, and he said, well, frankly, I think it's actually, and this is his exact words, it's shit. You know, take the feedback. And so I went away sort of thinking, oh, this is really difficult. Again, it's exactly what we're trying to do, many of you with HeadStart, is integrate all these different ways of doing things. And then they rang me up a week later, and they said, and I was really surprised, and they said, oh, well, could you actually come along and help us write something for parents, because we think parents need some support around resilience building. Would you help us? And I said, fine, yeah. I didn't, to be honest, between you, me and the world, because it's being filmed, I actually didn't really want to do it, because it was very hard. It wasn't the easiest of things. To be quite frankly, speaking as a CAM therapist, I was much more comfortable sitting in a room with my little clinic, with the 50-minute sessions, people coming in and out, then supporting a large group of young people with mental health difficulties write a guide for parents on resilience. Which would you have all chosen? Interesting, isn't it? You know. Anyway, we did that, and Lisa Buttery was one of the key people involved in that. And actually, it really did happen. They wrote it with support. They had a facilitator as well, but it was their piece of work. And that journey was really interesting for me to be on with them.
First started working on the book with the university. I was in quite a bad place. I was self-harming quite a lot, and I was severely depressed. And I wasn't too sure about resilient therapy, but slowly as we worked with the university, I realised that it was quite appropriate, and it was something that I'd already been doing, and I realised that I was actually quite resilient as a person.
Okay, so that's Lisa, who actually, it was many years ago now, and she has stayed involved in the boingboing community. And I'm just again thinking about issues around sustainability of HeadStart. What we do is very, very small compared to what you're embarking on in your partnerships, but it's been quite interesting for me to try and support the building of a resilience-focused community over time, over quite some years now. And this is a young person who took a real initiative around writing that book and has gone through many different stages and is now actually working at the university with a job in our team. And really quite interesting trajectory that Lisa's been on. But those two stories, Paul and Lisa, just to me illustrated some of the conundrums that we're all facing in this world. And these are the two things that I constantly come back to in relation to resilience-based approaches. Whose resilience is being built, and then how? So what are the best ways? Is it through an intensive treatment programme in CAMS? Or is it through some kind of more schools-based approach? Is it through something that's actually what we're doing in our work is building a community of people in all different areas of life interested in applying resilience to their own lives and also beyond in different ways. So I just thought it was worth taking stock today about what everybody is doing in relation to HeadStart, but also in relation to my own work. How am I challenging myself and our group to really be thinking all the time who's included, who's in and who's out, who's around the table, who isn't. And certainly all the issues that you might have around partnership boards and who's on those, but also very much around the actual children. We know that there are some, particularly young people, who are massively overrepresented in terms of mental health difficulties. Young people with learning disability, they have 4 times as many mental health difficulties as other young people. LGBTQ and questioning young people, they have higher rates of suicide, massive overrepresentation. I mean, as a researcher, I know there's many complexities with this evidence base and the data, but you can't get over the fact that also young people living in poverty overrepresented. And thinking about BME young people as well, very complex picture there, because for some groups of young BME young people, they actually are not even going to CAMHS or involving themselves in formal child and adolescent mental health services. On the other hand, later on in adult services as well, we see overrepresentation of other groups. So it's a real issue for the partnerships here, and I'm sure some of you have got some fantastic expertise around these different areas that would be great to cross-fertilise more on these. This morning we were hearing from the lady from Birmingham talking about having parents of children with learning disabilities and children with learning disabilities involved in decision making in commissioning, you know, which again I'm very fascinated to hear if other people are doing those kinds of things and what it looks like and how you're managing it. Because to me, in our community, it's a constant challenge to support the involvement of some of the most disadvantaged young people. And you know, I really try to keep a tally of that. We've got lots of work with fostered young people, but I know from my own experience how to sustain that and embed it as a community development approach is tricky. One thing that I was going to flag up that I haven't heard many people talking about in relation to HeadStart, but I'd love to hear your views, is how much you're taking account of your equality duty in your work and whether you're using it to your advantage. Because I say this because there's a small grant I got for something a little while back, and I actually made a point of mentioning the equality duty as part of the reason why we needed a particular enhancement of funding. Because actually supporting disadvantaged young people to access things is more time consuming. If you're going to make it work, you have to scaffold things for the young people, you have to go and pick them up from their houses sometimes, all those kind of things. So, and actually drawing that a specific reference, the equality duty, was useful. Many of you using that or drawing on it or thinking about it? Yeah? Just to flag it up as something that I think is useful. So really this is what I want to now be thinking about as well. How well do resilience approaches do in fostering equality of opportunity and good relations, which is really very much at what is at the heart of the equality duty. As an aside, I should say there's one group of children on this picture here who are left out of the equality duty. Anybody know who they are? Children living in poverty. So again, there's been some quite interesting discussions about a word called povertyism, that we see all these others, we've got disability, you know, but povertyism, actually children being systematically discriminated against because they are poor, is quite an issue. And at the end of this presentation, I've got quite a few references. If anybody wants to go and read up a bit more about any of the guidance or ideas behind some of this, you know, there's quite a lot out there. Joseph Rowntree Trust, for example, have done an interesting piece of work on povertyism. So I really want to tackle on the head some of the critiques of resilience-based approaches. Now, this is one that I hear a lot in my world, interestingly, I don't hear that so much from people involved in HeadStart partnerships. And I wonder if, I was with one partnership and they were saying that they'd been quite challenged by a GP, I think it was, who was quite critical, saying, oh, you know, this is just like a sticking plaster because there's all these inequalities and actually all you're doing is sticking something on top. Yeah? Anybody else had that in their dealings with people around HeadStart? No? I think it's something to be looking out for. I really do. I think it's quite one of the risks, if you like, to the work that you're doing, and it's important to be able to articulate response to it, particularly in the light of increasing austerity measures in some areas, well, in all areas really, that actually this is some of the social policy critiques. I read something that someone wrote the other day, it's called Resilience is Futile, and I do get the occasional emails from people saying, oh, why are you doing all this resilience stuff? It's a total waste of time, you know, go out and do something more meaningful instead. So I'll be interested, if any of you get any critiques from anybody like that, I'd be interested to hear them, because what it's made me do actually is think much more clearly, in my mind anyway, about the relationship between resilience and equality. And so a couple of diagrams here. For some resilience-based programs, it's really just about helping individuals, maybe even a few individuals, get round adversity, right? You know, particularly, you know those stories you hear about, you know, how some amazing young person was in a dreadful space and then they managed to climb out of it, and aren't they amazing, and every other young person should be like that. There's a real danger with some of that, but that's the kind of model for that they kind of, adversity is still there and they skip around it. And it's a really strong narrative in the resilience world that many of you may have heard. That it's an avoidance of adversity. But if you think about it actually, so that's about beating the odds, if you like, the survival of the fittest. But actually what I'm more interested in is how you use the resilience approaches to beat the odds and also change the odds more systemically, which is absolutely what HeadStart is about. And to crystallise some of the visioning that people are doing, really to think about how individual actions with individual children, families, schools, and even very local communities then feed into more area-based policies, and eventually into government policy potentially, or national, even international, is a really interesting way to think about it, to my mind, and can also sharpen up some of what you're doing sometimes. So there's a more formal definition that we have, but it's really about actually subtly altering or even dramatically transforming aspects of that adversity. How many of you think that's what you're doing with HeadStart? You're trying to, go on, don't be shy. There's a few of you, I know, because some of you have talked about social movement, revolution. I have certainly heard people talk like that in particular parts of the HeadStart community, and you could call us a community here. There's a question, isn't it? What are we actually trying to do if you're trying to achieve a system change? So this is how you might put it pictorially. Another way of seeing it is that actually, rather than going round adversity, you're actually changing the nature of what that might look like. Okay. So this is a real crystallization of what I'm interested in, is how do we actually manage the story that I started at the beginning with. How do we actually think about Lisa and Paul in the same ecosystem? Now, does anybody know what that is there, those trees? Tropical rainforest, which is the most complex ecosystem in the world, apparently. So I was trying to think of a more discreet metaphor to put the treatment in, and look, I've got a load of shirts. How creative. But there is something for me about not losing some of that work, the really important work, but also trying to think about where it fits in a model that is much more ecosystem-like. So, for example, I was talking about Paul with the CAMS intervention issue. Well then, after that, he ended up teaching at university. Well, that was just because I happened to be teaching at university. There was no system in place. Nobody had commissioned for it. But actually it was fantastic for him in terms of his eventual placement at university. We were able to support him with his application. And honestly, I would probably say that if it hadn't been for that bit, he wouldn't have gone to university. He might have done later on, or something else might have come along. But if he'd just got his CAMS treatment bit and all the other things in his life had been the same, then he wouldn't. So that was the sort of bit that shifted that. But also, obviously, without his CAMS treatment, he probably would never have gone to university, because he would actually probably, terribly to say it, but he would actually probably be dead. So, you know, really complex issues we're all grappling with here. And I put this up here because this is really just a follow-on from Pauline's, Mark's presentation this morning, where you're thinking about these different levels, but I'm also trying to think more about these country level factors as well, and local service sector levels. So a concept of community is broader than neighbourhoods or schools, but actually thinks about how we're trying to affect radical change in some of these areas. So I think what I want to do is just leave you, sorry Mike, it's not, with a small bit of this video clip, which is about what we've been trying to do is use some of the university capital, which is a large organisation with lots of resources, and I know some of you are working with universities too, to actually be part of building a resilience community. Now, I think this model works for universities, it could work for other big organisations. Some of you are working with football, Southampton's working with a football club, aren't you? You know, big organisations that have a lot of resources and can help in a kind of overall mission. And this is how some of the young people that we've been working with have framed the work that they're doing with us at the university.
Do you know what resilience is? I do. It means doing better than you think, in hard times. Some boffies at the University of Brighton have been working with lots of different community groups. Together we come up with a resilience framework. We found lots of ways of helping people use the framework. Using ideas from the framework helps us become more resilient when times are tough. It's been interesting working with the university. Before I worked with them, I didn't know what a university was. It's like a school for adults. In some universities, I could do projects and stuff. Some universities want to make sure everyone in the community benefits from their work. It's not just for boffins. Quite right, why shouldn't I benefit as well? Not just young people who got lots of good exam grades or who went to posh schools. So, we did lots of work with the University on resilience. A chance came up for some of the groups who have been working with the university to travel to the Connection Community Showcase in Cardiff. At this event, we can share with everyone the work we have done together. We are very excited about the trip to...
Stop! How will they there?
We needed money. Some of us had support needs that had to be paid for. People organised things that had to be paid.
Okay, so I'll stop it there. I mean, you can actually you can certainly see all of that video if you want to know what happened with that. But you saw that young person there, Lisa. She was sitting on the floor, and she actually, this was a very prestigious event. This was a connected community showcase with a research council that, in my world, is very prestigious. And we won a bid that was co-written and developed with young people to have a showcase event at the showcase. And Lisa co-curated the whole exhibition. She was basically in charge of it. And the university put a lot of our resources into making that happen and supported them. So this was really a bit of a plea to use some of your large organisations locally. It might be businesses. You know, I have this vision of everyone going into Waitrose one day and there'll be all these young people in Waitrose behind the delicatessen counter, doing all the fruit and veg, you know, the odd twice a month or something. I know there'll be all these health and safety issues with the meat slicer or something, but just to really think, for me, it's been fantastic to have all those resources to draw on. It's not our core business in a university, actually, to be supporting people with learning disabilities, young people who won't ever go to university, but we've made a fit with what we're doing and what will be for them resilience-based aspirations, and it's really challenged lots of structures and processes in the university, but also helped us learn different ways of doing things for the better. So I was just thinking about coming back to Lisa and Paul there, to finish, that for me, the big challenge of HeadStart, and actually for me it's much broader about the resilience work that we're doing, both in the UK and internationally, because we're not the only ones struggling with this. There are no beautiful models out there internationally where they've got it all totally sussed, I know. But to work out a system that has room for Paul and Lisa and all these other young people who are just going to school and maybe have very, very mild mental health issues. They have their own place to fit. And I think to finish, I want to just tell you about this private school that we've had some interactions with, because we were asked to do a piece of work, actually a talk in a private school, and I wasn't very keen because I tend to work with the public voluntary sector. And but then I asked my colleague to go along and do it and really think more about a resilience inequalities model or equalities model with some young people in this private school who were very, very advantaged. It's not to say they didn't have some of the mental health problems. We know that some, particularly in some boarding schools, young people have the anxiety and depression be really high. But it was more from a point of view from thinking about them, with them, a community development approach to resilience promotion, and presenting this sense that actually in many ways they were very privileged young people. So it wasn't like, you know, we've got this kind of targeted intervention that is just for very disadvantaged people and we ignore the rest of you. It was really, what do we then do and how can the rest of you be supported to be supporting other people too? More of a community development approach. So and then the other day I got an anecdote after this, which was about somebody's mum I'd met, who her daughter knew someone who was at the school and was saying, oh yeah, one of your team was giving this talk, and she said it really shifted this young woman's thinking, because she never really thought about her own privilege before, and actually was has now got some direct debit. Half of her pocket money is going to support a disadvantaged young person in a country overseas. And I thought, that is quite interesting, that approach. And again, for HeadStart, how do you draw on some of the actual capital, the social capital, cultural capital of your more advantaged young people? Would be great. And then I'm going to leave it there with one sentence to say, which is thanks to a young person who helped me with the clips. I had to do some work in the middle of the night on some clips, and for the video clips, and I don't know how to do it, and it was one of my sons, and he said, I'll sort it out for you, Mum, you go to bed. And he sorted it out. He knocked on my door at 1:30 and he said, Mum, I've done it. And I was like, wow. And if you think this is a story, me showing off about my middle class young person, those of you who don't know me, I adopted 3 children from the care system, and he came to our family with a diagnosis, attachment disorder and all sorts of different diagnoses, including quite significant learning disabilities. And this is a young man who sorted out my IT for me in the middle of the night. I mean, that's a great story of resilience to end on. Thank you very much.